Before we continue with the rest of the risk factors, where I'm coming with my full chest to attack a lot of people, just wait. There was a time, God rest my dad soul. He was sick, and everybody in the family was like, they think he's went to. This is the time that you have to be as a person.
Yeah.
Thank God that they had me in the family, because it is a lot of misdiagnosis, mismanagement, and I'm not the one to be saying people should start suing people, but start suing people. They could have killed my dad even before he died. When he died, I went to an hospital.
Yeah.
Meanwhile, I mean, I don't want to speak of the ill of the dead. I don't want to go into the worst them.
Okay, I'm not feeling emotional.
It's fine.
Okay.
He was diagnosed here of an heart condition. He had congestive cardiac failure. Then there was a medication that was given to him to take to up the heart to beat. Then someone gave him an overdose of that medication. And you know, cardiac medications, you have to take a certain dose to the T. If you do above, it's going to affect your heart further. So the person gave him overdose, then he had to rush him back to the hospital. I mean, the heart was starting to fail actually. Like the heart it stopped, not like stopped working, but like it started to fail. He couldn't breathe well.
Was
It
it
started having,
Was it bradycardia or like?
It was bradycardia. Bradycardia, he had low heart rate. It was bradycardia. Then he started having swollen fluid and all. So, Ashala, the Sha called me. That was when they called me. They didn't come when they firstly took him to the hospital, where I could have helped with educating them about what drug they should take, how often they should take it. That's why we say, as healthcare workers, you guys need to do better. I know like the workload on you, and you guys understand.
You need to
But you need to look after your patient and make sure their rights are not infringed upon. If you don't feel it's safe for you to take care of all your patients, voice out. You have to voice out so that the management know if anything happens, they sue you. You can document that. When you tell the management, you can document that I told management that it's unsafe with this number of patients. I know I was saying to you that I don't want to mention the government or anything like attack the government or anything, but I'm going to say this. As a government hospital,
the government has the right. I mean, there can be a positive change if the government is not involved.
I'm going to continue my dad story. I'm coming. As the government, you guys have a lot of responsibility. Yeah. While as a student nurse, I'm going to say this because I think it's actually wrong. Then I think, they respect me and they think I know a lot of things. I was a second year nursing student in School of Nursing. And this is why I think moving to the UK has taught me a lot about healthcare practice and all.
And advocacy. In nursing school, they teach us that as a nurse, advocacy is one of our forefront.
As an abstract.
I mean, but then in the advocacy itself, our fellow medical colleagues, they would not even allow you
to advocate. So what I learned my example wasn't. I know I'm matching the story together. I'll continue. As a nursing student, second year nursing student, I just finished my first year on a 3-year course. Second year, that's when I need to start learning, gaining medical clinical experience. It was my first time on a night shift. Guess what they did to me? There is an infectious. I was working on an infectious ward. I'm not going to mention the ward. But some of you might have known. I've mentioned the hospital I trained. Some of you will know. They put me as a second year nursing student on the ward alone. There were only two nursing staffs on the ward. 2 nursing staff. The major ward is 15. I was about to mention the hospital. The hospital is it's 15 bedded ward, isn't it? 15 on the major ward, 15, and the small ward is 10 bedded ward. Yeah. The 2 nursing staffs, they were on the major ward, the main ward. They left me as a nursing student on the. I do not have a license. I do not have a backing. They left me alone on the small ward. And this is a night shift, and they might say, the patients are sleeping. But there are some things I know, I was learning and all. There are some things I might not be able to recognize that
And
this is
warning signs,
early
like
warning
you said,
signs of
yeah,
some
or
disease,
deterioration.
whereby I might just say, oh, the person is just snoring and all. And someone might have died. Thankfully, nobody died. But I'm just concerned at the level at which we practice in Nigeria. So let me continue with my dad's story. That was just by the way. I just felt like I should share that as of raising concerns when patients' lives is at risk.
And then we can't actually entirely blame the nurses.
I'm not blaming them. I'm blaming
because
the
they were
hospital.
short-staffed. But I mean, we will blame them again because they need to take responsibility. Somebody could have been with you and the other person on the other side. Management, another
But
problem.
the major word is like
It needs attention
chronic.
to register.
Yeah, it's chronic.
Nurses.
One person could not do the job. It's chronic, like chronic word. The patients are really sick. So imagine one person, a nurse. So we have 25 patients on the whole ward. 25 patients, a nurse to, is it 12 and a half patients?
Yeah, 12 and
12 and a half patients, and the other one 12. And as that's safe, how will I be able to provide individualized holistic care? So
not that before you go back to your dad's story, I'm
Yeah.
so sorry. Not that
That's
we
fine.
haven't talking about kidney. I'm sorry. My posting to a kidney ward. My posting to a kidney ward in the same place.
Yeah.
I worked with same
Yeah.
one SNO, senior nurse officer, nursing officer. Then I don't think they use SNO again. And then one NO, that is
Nursing
NO
officer.
one, nursing officer one. So a senior and then
junior.
the least junior staff nurse, and I was the other.
nurses, right?
Oh my goodness! I walked on this day. I walked too much that I knew that I walked, and that is the only posting I ever remember
They will tell you.
because it was too memorable. And then one thing is, we had 3 crash patients on that ward.
Ooh.
2 of them died. 2 patients died on
Oh,
that
my
shift. What could we have done differently? And what I remember vividly was that nurses from other ward had to join us because 2 of them crashed at the same time. And how many doctors did we have? 1 MO. Before the MO even came, nurses were even doing chest compression. I was made to look after the other patients because on kidney ward, you have to drain back, you have to change infusion, you have to give. We were giving antibiotics because then I think things have changed. This is another thing we are like saying government should have a look into what is going on in hospitals and medical and healthcare system in Nigeria. Because I think what we could give them, I don't think even nurses could give them now. I could give some small IV antibiotics and then analgesics then. Now I don't think they can even give them now. I mean, I'll leave this for the nursing bodies to fight. I was one doing all those things. Same as you, I was in my second year. I walked and walked.
Officer.
Mind them, we also had a side roads full. Observations for everyone in the midnight, in the morning, urine output every day. I walked that I knew that I walked.
That's another thing. They'll be like, oh, you are here to learn. How's that learning? You are using me for free labor. What am I learning?
At the end of the day, I think I looked so haggard that everybody was looking at me. All the students that came in the morning were looking at me, like pitying me. The way I slept on that day.
Yeah, let me go back to the story. So, the second emergency was rushed, and I had to go to the hospital.
Yeah.
Just look at my dad. I was in my first year. I think that was before I did my 6-month exam. For people that went to nursing school, is an exam for you to. It's like the first semester exam. That if you don't pass, they will send you out of nursing school. So it's called weeding exam. They treat you like a weed. They threaten you and all. So let's leave that. That we'll share our stories one day of experience of nursing school.
We should write a book.
So I went to see my dad. Then the hospital, they did some scans. We had to go to all these diagnostic centers to do scans, which is far away from the hospital. The hospital does not have the infrastructure. It's a private hospital. Go to a different part of Ibadan to do. There wasn't. So from New Garage, we had to go to, I think UCH, or just opposite UCH. There's one diagnostic center there. We went to different diagnostic centers on that same day.
Yeah.
A lot of them, they are not working. They don't have staff on ground to do stuff like that. So we had to go to the one opposite UCH. During that time, UCH was on strike. The nurses were on strike. So it was just the doctors. And when nurses are on strike, admission doesn't take place because there's nobody to look after the patient. So they don't admit. They try to discharge as many as possible. And let me just end that story there. So they took him, did some scans. They saw his cardiac function was low. So that's why he was diagnosed with congestive cardiac failure. So what's the name, went back to the hospital. They wrote a referral letter that is beyond them, that we need to go to. I don't know if I should mention hospital. Should I mention hospital?
Tertiary
No, not a
institution.
tertiary institution, like a secondary institution now.
Why?
So
Oh, because
was
the
a
tertiary
private.
were once strong.
Yes, it was a private hospital. Yeah, private hospital referring to a state hospital, which is the secondary one,
Yeah.
which is not
The
a tertiary.
primary are just
No, it's not primary now, it's
private are
private.
just primary.
I mean, they're specialized though. Some of the
should be
private
secondary
specialized.
then. They should
So
be
they are
secondary.
secondary, but they don't have the specialization, the specialty skill required to
Oh,
treat
yeah,
in
so
there.
yeah,
So
yeah.
a government hospital has a lot of specialty.
Of course, they train specialized
Yeah, so-
specialist.
They took us to the hospital. Then I was holding the referral letter. I had a read of the referral letter. Then I gave the doctor, before they took us to, nobody attended to us. We were in the car park waiting for a doctor to come and review because the tertiary were on strike. And in Ibadan, we have just one, I think we have only one, is it one or two in Ibadan, tertiary institution, UCH, and I don't know if Adeoyo, the one at Ring Road. Oluyore is a secondary
Yeah,
hospital.
yeah, secondary.
The one in Ring Road, the Adeoyo Ring Road,
Yeah.
I think is a tertiary.
It's-
I'm not sure. I'm not too sure.
Actually, it should be secondary.
I'll just leave that as that.
Yeah.
So we went to Oluyore. I said I was not going to mention the name of the hospital. So we went to Oluyore. Then the doctor, it was very funny. Was the doctor? I know a lot of people might come for me and all like that, but the doctor looked at it. What's the name? And they wrote, like, when they did the scan, they were not really sure what it was. So they wrote a lot of diagnosis, queried. And when you say queried, as a medical person, as a second year student, I was not a second year, I was a first year student with just maybe 3 months of clinical experience. When you say queried, does not mean they don't know what you are.
It's not a definitive.
It's not a definitive diagnosis. It's just a query diagnosis. Everybody, as healthcare workers, we are not magic workers. We need to do differential tests. When I say differential diagnosis, we make tests. That's when they say, go and do this test, go and do that test to know. So when you write query, it's based on what you've learned and what you know about the disease condition, the signs and symptoms you are seeing. You need a test or a diagnosis, a differential diagnosis, to be able to determine,
To point out
exactly
which
what's
of them.
wrong.
Yeah.
So they wrote queried cancer, lung cancer, because he was having shortness of breath. So they wrote queried, and I think he had fluid buildup in his lung or around his lung, I think. So they wrote queried cancer, queried this, queried that. Then went to the hospital. Then the doctor reviewed. He said, your dad had cancer. I was like, what do you mean cancer? You can see here, sir. I was like, you can see here, sir, it's queried. Then he said, since you think you know more than me, I'll be taking your dad away. Then I was like, all the best for you, sir. Thank you. Then I was like, let's go. Then my brothers, they were like begging and saying, please take us and all. Then I was like, then it was like, they don't have availability in the hospital.
No best space.
No best space, yeah. So I was sure, like, let's go to private. We went to 5-6 private hospitals that night before we found one. They even got to a point when the police had to stop us because they kept saying that we were speeding and all, because it was deteriorating fast. And when people are when you'll be saying a lot of things like take care of yourself, this kind of things. So he was already saying that he wants to go, man, go and die.
Are you okay?
Me, I'm fine now. So he was saying that in the car. Then the police had to stop us. That why are you guys speeding and all? Then he saw we had a patient in the car. Then we had a police escort. We had a police escort that day. That was one of the days that police is your friend. So we had a police escort. It was Operation Bust. Those operations with police and soldiers.
Yeah.
So they escorted us to the junction of that hospital. So we went to that final hospital, whereby they took him emergency. They had to call one of the attending. They had to call someone from another hospital to come and look at him. But that's that. So it was that hospital that they saw, and they were like, oh. When I got there and I spoke to the doctor, the doctor said, it's not cancer, it's not what's name. I was like, thank you. He thinks it's a cardiac condition, and based on the echo results, is cardiac condition, and they would only offer him emergency care to relieve the symptoms. when the
Security.
cardiologist come tomorrow, they will invite the cardiologist. We have to pay and all. But thank God we were like buoyant. Some people might not be able to pay all those exorbitant money. Where am I going? This is where misdiagnosis, thankfully it got better and he lived a fulfilling life before he died based on complications of the condition. But he offered him, I think, extra 4 years to live or 5 years to live, which is something he wouldn't have had if we had not found someone to take care of him, that diagnosed him rightly and took care of him. So my own concern about this is that know what they are treating you for and what is confirming what they are treating you for. That's my own concern. We would have another episode to talk about all this. I think we've taken time with that story, and I'm not.
Should we take a break?
I'm not planning
Water
to.
break.
Yeah, I'm not planning to be mushy and all. I'm not.
Now let's get water.
All right, we'll be back. We'll just take a short one.